So for renewal, it opens on February 1st, usually. This week, it's a little bit later because of technical difficulties, but usually it's every first of the month for February. And then the deadline is end of March. So make sure you renew your license before that, because if you practice without your license, of course, there's consequences to that. So the first step you need to do is BCCNM.ca. So you go on the window, and then you should be able to see this. Okay, so that's the link, and then you just click this. So I'm gonna go over it with you step by step because I actually have to renew my license as well for registered nurses. So today we're just gonna go over registered nurses, but it's gonna be the same step if you're an LPN or RPN as well. Okay, so you're gonna click here. So registration renewal is open, and then you would click registered nurses, and then it'll take you to a window where you need to sign in. So I already signed in. Okay, so when you sign in, you just have to put in your email address that you use and your password, and then it'll take you to this window. Once you sign in with your account, then it'll say it's renewal time. What would you like to do? So renew, change my registration, or cancel. For me, I'm going to renew my license so I can continue practicing. And then, like I mentioned earlier, it says here you have to renew by March 31st, 2025, right, to maintain your registration. So we're gonna click that, and once you click that, you should be able to get to this window where it says renewal. So this is my current window because currently practicing right now, so it should say your current status, current practicing RN if you have previously registered before. But if you're new, then it'll say non-practicing here. So you have chosen to renew, so we're gonna do RN practicing, and then we're just gonna click continue, and then again continue. All right, so it says my name and then my current status, and then it says here how to do the process. So, and then we're gonna click continue. So about the self-assessment questionnaire. So this is something that we have to do every year as a registered nurse or as an LPN and as a psych nurse as well. So it's gonna ask you questions here. Okay, it's mostly about self-assessment of your practicing. Okay, now we're gonna complete the self-assessment questionnaire, and then it's gonna ask you, so do you spend 50% or more of your nursing practice in direct patient or client care? So based on this question, if you answer yes or no, so basically it's asking you, are you working bedside or non-bedside role? I'm currently working as a nursing instructor, so I'm not working bedside. So I'm gonna click, and based on your answer, the questions in terms of self-assessment will change, and it will say that here. You cannot change your answer once you proceed past this page. So we're gonna go next. All right, so these are the self-assessment questionnaire. So I'm gonna answer my questions and then I'll film the next portion. Once you have answered your self-assessment, you have answered all the questions, it'll take you to this window where it says continue renewal. So we'll click continue, personal information. So just make sure you verify all your information like your address, phone number, and email address, and your full name as well. And in this question regarding indigenous identity, do you identify? So you just have to answer yes, no, or prefer not to answer. Then save it. And it's gonna ask you for additional education. So if you've done as an IEN, if you've done additional education related to nursing or another degree, make sure you put it in. And then were you employed as a nurse last year? So yes, no, depending on your answer. Employed refers to any RN, NP, or LGN practice, including volunteering that you have done in the last year. So I'm gonna click yes. And then you have to fill out your employer information. Okay, so you just have to click how are you employed in nursing on a regular basis or casual basis, your employment status here, Have you practiced as a self-employed? Did you volunteer? And then this is where you're gonna answer your hours as well. So to be practicing RN or LPN here in BC, you have to complete 1125 hours in terms of your practicing hours. Okay, you can also click if you're unsure if your hours counts towards the practicing hours. You can click here and then it'll show you the practice hours requirement. So here are some alternatives if you didn't practice for 1125 hours, and for the 1125 hours it's within the 5-year period. You're gonna count all your hours. All right, so you need to have 1125 hours within that 5-year period. But when we are doing our registration, you're only gonna enter the hours that you did last year, so 2024. Okay, so for your alternatives to your hours, I'll say here, so if you completed an RN nursing education program, or if you're an LPN, I'll say LPN education program. If you did a nursing re-entry recognized by BCCNM, that also counts as your hours. If you did a supervised practice experience, that counts as your hours. Or if you did an RN degree program or you're currently employed, that will also count towards your hours. Okay, and for your hours as well, you can count practice hours if you are holding an RN or LPN. So that means as long as that job specifically says that you need to be an RN or LPN to be working this role, to be working this job, then that will count as your hours. All right. So there's more information here in terms of practicing hours. I'll just click what cannot be counted. So if you're on call but you're not actually working, then that doesn't count. If you're predominantly selling products, then it doesn't count. If you're taking care of family members or friends or neighbors, it doesn't count as well. Time spent in a learning capacity, for example, a course or certificate program that is not directly related to nursing practice, it doesn't count as well. I'll close that window and then just enter all your information here. All right, so once you entered your hours, you answer the previous questions, it'll take you to the employer information. So you just have to add your employer here. So add employer, and then it's gonna ask you for the information. So the health authority, right? So Providence, for example, Fraser Health, Urban Vancouver Coastal. Is it your primary employer, right? So you can click yes. Hospital, the start date, work address, job description, and all that. Then click save and continue. So once you have entered all your employer information, it'll ask you for this question. In the past year, have you applied for or hold registration with any other professional regulatory body other than BCCNM? So if you are practicing with any other professional regulatory body, so for example, you are working as an RMT, registered massage therapist, then you have to answer that question. And then it's going to ask you for a criminal record check, right? And you answer all these questions. Okay, so I'll take you to this question of personal practice review. And with this question, what it's asking you is if you have done self-assessment during your practice, if you develop yourself professionally, like when you are working as a nurse, you always have to analyze and observe your nursing practice. Are you practicing under your scope of practice? Are you practicing using the professional standards according to BCCNM? So if you are doing all that, then you have to say yes or no to this question. Okay, and then you just have to click yes or no, and then save and continue. Okay, now we're gonna go over the payment section. So this one is asking for the professional liability protection and association membership. Make sure you read all this, and then you just have to choose between option 1 and option 2. Okay, so once you have answered that, it's gonna ask you for subscriptions, so academic study and things like that. So just click yes or no with subscriptions, however you want to subscribe. All right, so when you go down to this window, it'll also say something about the fee reimbursement for Nurses Bargaining Association members. So this process will be managed by the employer. So if you are working for Providence, for Fraser Health, Vancouver Coastal Health, so if you are covered, what you have to do is you have to check with your employer because it's the employer because it's your employer who will be in charge of that. So just make sure you check with your manager. Or if you have a nurse educator on the floor as well, you can ask them about it. But once you start working in the hospital, usually they go over this as well. And you're not falsifying any information. Okay? And then acknowledgement and undertaking, and then you do save and continue. So after that's done, then I'll take you to the review. And then if it's all like blue, that means you have answered all those questions. And then in case you want to change anything or edit anything, now is the time to edit that. So just open the details and then I'll show you all the answers you have submitted so far. All right, so once you have submitted all those answers, now is the payment section. So with the payment, I'm gonna give you guys two options. So actually, it's not me, it's BCCNM. So you have two options. And for the options, you have two options given by BCCNM. It's either you can pay everything all at once. So the payment will be $825. At least for me, it's $825 and 30 cents for my registration. So you can just pay it all at once when you register. Or what you can do is you can pay monthly as well, which I've been doing. So I've just been paying monthly. They just take it out of my savings account. And then, so by registration, I have already paid for most of it. And if you see my window, I have pre-authorized payments. So I already paid $794, which I've been paying for the past year. I only have to pay $35 here. All right, so once you have done your payment, you're pretty much done. And then I'll tell you that you are registered just like here. And for your tax receipts as well, you can print it or save it, or you can just go to your account. But this is not your tax receipts. During tax receipts season, you'll see it under the BCCNM website as well. And that's it for our registration renewal. I hope you guys found that helpful, and I'll see you in the next video. Please don't forget to like and subscribe. Bye guys!
If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video!